Hello friends, welcome to the Healthcare Today. Today we are going to speak about bronchoscopy indications. As I told you in the previous video, we have two types of major indications. One is diagnostic indication and one is therapeutic indication. When you come to diagnostic indications, you intend to diagnose what is the primary problem in the lung. One such examples are taking bronchoalveolar lavage, where we put normal saline and clean the abnormal area and collect the sample so that the sample can be sent for analysis. It is done in tuberculosis, suspected recurrent pneumonias. All these patients, we do this procedure. Sometimes there is a tumor in the airway leading to breathlessness and you need to identify which type of tumor it is. So we take a biopsy from the airway, which is called endobronchial biopsy. Many times the tumor may be or a nodule may be present away from the central airways, somewhat to the periphery. In those cases, what we do is we put in a forceps, go blindly into the area and take a biopsy from that area, which is called transbronchial biopsy. Apart from this, there are other therapeutic indications where we use bronchoscopy. One such indication is hemoptysis, when the patient coughs out blood through his sputum. That at that point of time we do bronchoscopy, we identify the source and we put some sort of drugs to stop the bleeding there. And there are many other therapeutic indications which are like removing the tumor, removing any abnormal substances which are present in the airway, such as thickened mucus, blood clots and some foreign bodies. These are all therapeutic indications of doing a bronchoscopy. These days bronchoscopy has evolved into much better knowledge because of the safety of the procedure. Many times patients develop tracheal stenosis post intubation. Patients develop an abnormal noise while they are breathing, which is called stridor. So these days we do bronchoscopy, we use a balloon and inflate the abnormally narrowed area, thereby curing the stenosis permanently. So bronchoscopy is used as a therapeutic option in stenosis, and these days we are also taking biopsies using cryo. Cryo is liquid nitrogen which is at around 80 degrees centigrade. So by taking the biopsy in negative temperatures, the chances of bleeding is minimized, the chances of having airway complications are minimized. And there are other rare indications of therapeutic bronchoscopy where we can put a stent inside to prevent further stenosis or further tumor. When there is a fistula, for example a tracheoesophageal fistula where there is an abnormal communication between the trachea and the food pipe, you can use a stent so that this abnormal communication is blocked. One such rare indication of using therapeutic bronchoscopy is persistent air leaks, which is called bronchopleural fistula. To simplify, there is an abnormal communication between the airway and the pleura. Pleura is the outer surface of the lung which is normally free from air and fluid. So when this condition is there, when the patient is having bronchopleural fistula, once we insert an intercostal chest tube, you can see bubbling in the lower drainage seal. That indicates there is a persistent air leak. So by using bronchoscopy, we identify the segment and we occlude the segment by using a vascular plug, by using a ASD device, or we can use a gel foam where you can seal that area so that the patient can be relieved of the fistula and you can remove the tube immediately. So with the expanding horizons of bronchoscopy, it is very safe, it is less expensive because we do it in local anesthesia and general anesthesia as well, and patient can be discharged on the same day because it is a daycare procedure. Patient can be discharged on the same day. Many times patient need not be admitted because it can be done as an outpatient procedure as well. We care about you.